All right, good morning, everyone. Yeah, thanks to Jinlung and Busha and Jude and Ben for having us here today and for convening us. My name is Dave Carter. I'm from the National Research Council in Ottawa. I'm an engineer by training, not a PhD, unfortunately, solely a little master's under my belt. But I work with a team of about 20 people who do text analytics, about half of whom are PhDs doing both blue sky research and applied research. About half of us are engineers and computer scientists who take that research and turn it into big things. So today I'd like to talk about our work in collaboration with the Public Health Agency of Canada to build the Global Public Health Intelligence Network, and more generally talk about using news as a data source for surveillance. So there's three things I want to cover today. One is talking about the news in general. I'd like to convince you that it is an excellent source for doing early warning systems. Then I'll give you a bit of the intuition behind natural language processing. Natural language processing is a set of techniques used to develop, to extract signal from human written text. And then that gives us something we can count and do statistical analyses with. And then I'll talk about how we've brought those two things together in the Global Public Health Intelligence Network. News is awesome. It's not just good for infectious disease, it actually covers a whole bunch of different public health threats. So here's something from a couple days ago down on the east coast of Australia, where material containing asbestos was revealed by erosion and a beach was closed. So you can imagine this might not be an immediate threat, except to the people who discovered it, but you can imagine a lot of really valuable early public health interventions you can now do. So you could start calling around to the local pharmacies and see if there are any local patients who have been increasing their asthma med lately. You could talk to local doctors who are doing family medicine and say, hey, have you had any issues of people coming in with respiratory illness lately that you couldn't really pin down? That seems chronic and isn't really responding well to treatment. And similarly, you could start a long-term study and say, okay, if this is a new emerging issue and not too many people have been exposed, we just need to know that we need to do surveillance for this for the next 50 years in this area. So from this one news article that might not have come through traditional public health channels, you can imagine several different interactions that could increase the health and safety of the local community. And similarly, news is very timely, particularly in cases where a local public health authority might not be trustworthy. So this is an issue from a couple years ago you folks might remember, where there was a radiological release due to some weapons testing in northwestern Russia that started blowing up over Scandinavia. So there was not a peep out of Russia initially, but Norway raised the flag towards the middle of August in 2019. It took about a week for Russian authorities to come around and say, oh no, there's really no issue here, no problem at all. And then 2 days later, Norwegian authorities said, actually, no, we've really dotted our I's and crossed our T's here. There is an issue. There was a radiological release and it's across our borders. So this is all covered fairly well in the news. Thinking a bit more broadly for a moment, if we think of all the different kinds of signals that exist in the world digitally that we could pull into an early warning system, I like thinking of this as a bit of a trade-off. Things that are available very soon tend to be less certain, and things that are very certain tend to be a little bit late. So you could imagine the most timely signal in something like an infectious disease outbreak would be social media. People are saying, oh, I had to take work off today because I've got this runny nose I just can't shake. But this is a little bit unreliable in that people are maybe reporting symptoms, or people might say, oh, I definitely have the coronavirus. But they might have flu, they might have RSV. We have no idea what they actually have. So it's self-reported and there's no medical personnel involved. So it's very soon, but it's not very certain and may not be particularly reliable. There's also, of course, the challenge where there's a lot of euphemistic language, a lot of joking, a lot of worried well who express their sentiments in social media. A little bit later after that, we can pull data from Google about search activity. So as people are starting to get ill, they might Google their symptoms and try to figure out if they're really sick and what they need to do. So that's information we can get. Again, it's very early, which is great. It's still not very certain, and you don't know why people are Googling these symptoms, whether it's for them or for their kids. Local news is not much later than that. As soon as there's enough scuttlebutt around a given community, it tends to show up in the news fairly quickly. It's a little bit later than that initial social media activity, but if you have enough social media activity, some local journalist is going to notice and start talking to local epidemiologists and public health practitioners and say, is there something here? Do I have a 300-word article in this that I can whip together? Coming after that, you might think of modeling and information from adjacent regions. So many, as Bruce was covering, many diseases like malaria actually move from place to place. And if you know what's going on next door, you can make a pretty good prediction of when it's going to come to you. So if you can get reliable information from your neighbors, then you can make a prediction about what's going to happen locally. And similarly, air quality, temperature, precipitation, and flight data are also fairly good at trying to infer a signal. Still fairly early, but with a little bit of uncertainty because it is a predictive model at that point. If you look at a lot of places, an early place where we can get involvement from medical personnel is in a telehealth system. So we have these fairly commonly in Canada and in a lot of developed nations, where before you go see your family doctor or before you show up at the emergency room, you can call a nurse and say, hey, what's going on and what should I do? Health authorities love this because it's a great way to divert people away from the ER, but it's also a really good source of data. Generally, these calls are running in the 11 to 13 minute range, and the nurse who's on the other end of the telehealth call is taking copious notes that entire time. So it's a really good source of data, what they've ruled in, what they've ruled out. And often behind the scenes, the nurse has a triage chart that they're working their way through, and that information gets captured. So you can even see what things the nurse initially suspected and what they've ruled out. So that's a great source of data. It's a little bit later than anything like social media, but now you have medical involvement, and so it's much more certain. Then, of course, you have when people finally get sick enough, they come see a doctor, either in the ER, where you can get a chief complaint out of the emergency room, or you can get physician notes from a family doctor. These are getting fairly certain at this point, but people are already quite ill at this point. So maybe it's not as valuable from an early warning perspective. And now we're getting into the point, of course, where it's harder and harder to get this data. Social media activity we can get very easily. The moment you're talking about physician notes and ER chief complaints, data protection gets a little challenging. Down the path, you can think about radiology reports or discharge summaries. As people are recovered, there's information recorded that really captures the entire event that that patient has gone through. So it's very reliable, and you can tell what was done along the way. Not very useful from an early warning perspective. And often lab test results are even later than that. So you can see weeks-long turnaround on lab testing sometimes. At that point, it's very, very certain. But as we've seen with coronavirus, good luck getting a lab test these days. So that's a bit of the trade-off. We think, from our perspective, local news is a very interesting signal. It captures a lot of public health activity that you might not expect. So this is information in GPHIN at that magical time period of the last day of 2019 and the first day of 2020, talking about what's going on around the South China seafood market in Wuhan. So we had news coming into the system on the 31st. This is after the detection period. So this is at this point, ProMed had already alerted. Within Canada, GPHIN had already alerted. And several other systems were finally picking up on the initial reports of what was going on in Wuhan. But at this point, a full day later, there was already reliable news reporting on whether the market was open and closed and what public health people locally were doing to try to shut things down. So this is, I think, from an early warning perspective, an excellent signal. As Stephen pointed out, the WHO didn't put their notice up until January 5th. So 5 days before that, we already know that the market is closed. So action is happening on the ground, and it's already in the news signal. So I think that's pretty great from an early warning perspective. This might be a spicy take. I think there's a beneficial use to publicly available news when it comes to a trade-off between availability of good news versus availability of good local public health. My partner's family lives in a 3,000 person town in rural Mississippi. Mississippi is not known as a big government part of America, and you might describe the public health capability there as willing but underfunded. But a weird thing about small towns in North America is they still have local news that's well-funded. And because these small towns each have their own newspaper, they have a journalist who has content to generate. And they are very interested in reporting on anything that sounds like a mysterious illness. So they might not have the words for it, but they might say that if they know that 3 people locally are having lower GI issues, that will show up in the local newspaper and the people will be individually named. So there's this trade-off, and we see it in some places in the world too. The plague outbreak in India in the 90s, for example, the way the WHO figured out what was going on is they saw it on CNN. You know, the local public health authorities weren't getting the signal out, but the local journalists will. So I think, you know, in New York City, the New York Times is not going to report on local early outbreaks of disease, but the local public health authority is very well funded. So places where the news doesn't care about the minutia, the public health tends to be pretty strong. Places where the public health is pretty weak often tend to have, by coincidence, pretty good local news coverage that cares about the details. So I think it's a pretty good signal for early warning, particularly if it's breaking out somewhere where public health might be spread a bit thin on the ground. And my final thought on this is that it's available. So in my team, we've done work with ER paperwork, radiology reports, telehealth call data, and news. And we've done literature mining for medical data. We've kind of spanned the entire spectrum. And just being able to get data and not have to worry too much about how we pass it around really helps us build early warning systems that are sensitive and specific, but that we can also feed with data and actually roll out with a fair bit of ease compared to dealing with private medical information. There are some limitations to news data as a source. There are some countries in the world where the press is not particularly free. And even if the reporting on a given incident is pretty good, there might still be some questions in people's minds whether they can rely on the signal on any given day. There is some both sidesism. So you can think about respiratory issues related to the wildfires in California. You might have a public health person quoted with reasonable information about which way the winds are going and therefore which way they can expect some outbreak of respiratory disease. And then you might have some crazy politician talking about space lasers. And that's not a useful signal, but it will show up in the data. So sometimes, because journalists like telling both sides when there might only be one source that is valuable from a public health perspective, sometimes you get some weird, crazy things that are a bad signal. And of course, there's a bit of journalistic interpretation involved whenever a journalist is covering public health. Journalists as a general, and this is a general rule, are extremely well informed on politics, understand the principles of how nation states operate. They might be a little bit weak in general on math and science. So, for example, a journalist looking at Bruce's talk earlier, looking at diagrams of recursive neural networks, might not be able to capture information like that and reliably relay it to the general public. So that's a bit of a limitation. There is kind of a low pass filter happening in news when it's covering mathematical things. So that's news. I think news is a great source for early warning systems. I'll give you now a little bit of the intuition behind natural language processing. So natural language processing is about taking things people have just written and trying to get something we can count or measure out of it. The underlying intuition here is a very old linguistic property called distributional semantics. Macklin in '78 termed this, words are known by the company they keep. So if we look through these three sentences here, think in your head what goes in the blanks here. He was mugged in blank daylight. Well, instantly, especially if you're a native English speaker, you probably didn't have to think too hard about it. Just the word broad came into your mind. And it's unlikely that you would put another word in that slot. Similarly, in the second sentence, there were no weapons of mass, blank. Well, again, if you covered media in the 90s or 2000s at all, the word destruction has to go in there, and there's really no other choice. The probability is almost 100%. Next example, she blank on their door. If you think about how to fill that in, you have to think about it a little bit harder. So you might think of high probability words like she knocked or she banged on their door. But you can think of other things that could go in there. Graffitied, in the neighborhood I used to live in, vomited. You've got a lot of options that could fit into that slot with decreasing probabilities over time. But that's the intuition. So you have some sentences where there's really only one word that can go in the slot and there's a high probability. And then as you think of where you put the slot and what the construction is around the given blank, the probabilities start spreading out a little bit. So from an early warning perspective, this is awesome. So even if we haven't seen terminology before, we can use this idea of patterns around blanks to try to figure out what goes in the slot. So if you have a sentence like, this is the first reported case of blank, you can discover the terminology of a novel syndrome without even knowing what the word is. So if we say, after the WHO kind of congealed around the description of COVID-19 for the official name of SARS-CoV-2, any text processing system would have never seen COVID 2019 in its data before, but it can figure out that's a syndrome by looking at patterns like this, and it's seen reporting in the past on other syndromes that use similar language patterns. Similarly, we can put symptoms together. All 3 people reported fever, blank, and chills. Whatever goes in there, that's going to be a syndrome because we have a list construction And we probably in our data, for any given data set, would have seen the words fever and chills if we're talking about public health. If we have a sentence like, all patients reported having visited blank, that could be a country, that could be a particular hospital, or it could be a point source for infectious disease. Again, even if we don't know anything about Wuhan, South China seafood market, if our system sees a sentence like this, it can infer that whatever goes in that blank is something worth tracking. And final sentence is a little bit different, but as we have an infectious disease or other ongoing situation, things change over time, and being able to track when those changes happen is important from an early warning perspective too. So the mysterious illness has been identified as blank. Doesn't matter what goes in that blank, that construction pattern tells us a change has happened, a change point has happened, and that's something that we can detect, and that might suggest a slight pivot in public health action. So if you put these all together, this is our vision for using natural language processing for situational awareness. There's kind of two separate halves of it: knowing what's going on and then figuring out what to do. And I think a viable early warning system needs to keep both of these in mind. So natural language processing is about the computer learning about what's going on, and then you need something at the tail end of that to be able to generate hypotheses or have humans in the loop to figure out what to do. And that's where GPHIN comes in. So GPHIN is a collaboration between the GPHIN software at present was a collaboration between the National Research Council, where I work, and the Public Health Agency of Canada. This is the third or fourth major version of GPHIN over the years. Public Health Agency introduced GPHIN in the late 90s, as Stephen pointed out earlier today. And it's evolved over time. So when the National Research Council came into the picture in 2016, there was a bit of a rush. The Rio Olympics were coming up, and Public Health Agency and the WHO wanted to do effective surveillance with a bunch of people coming in from all over the world who might be sharing a bunch of diseases locally. And so we all got together and said, okay, the existing GPHIN had kind of reached the end of its technical roadmap and was getting a bit stale in terms of its abilities. Let's rebuild it from the ground up with really good natural language processing. And we did. So it is a global system. There's data from all over the world. Every country is covered. We have professional users in about 30 countries. The data coming into the system is largely health news, professional Twitter, even little bits and pieces of ProMed make their way in there once in a while, and epidemiologist reports. On a slow day, we have about 6,000 news articles coming in. That can go up to 10 or 12,000 on a given day, depending on what's going on. Documents come in right now in 10 different languages. And it is a network. There are about 900 pro users around the world who use GPHIN. A lot of data does come into the system. Most of our news we get from Dow Jones Factiva. So Dow Jones, you might know from the New York context, they have a product called Factiva that lets you collect news that has been published around the world and pay for it. It also ingests professional Twitter, so the Helens Branswells of the world, as well as the Zeynep Tufekcis, sociologists who are doing a really good job of covering news and research and being able to boil it down for the general public. There's also a bunch of RSS feeds, including Google News searches for things like mysterious disease, again, trying to get those early signals in. And there's an ability for the analyst team at Public Health Agency to push any kind of data that they want into the system. On top of that, that's where the news comes in. Public Health Agency has built this awesome keyword ontology as well. They've been working on this and iterating it over 25 years to figure out what kind of keywords have public health value, how do they get expressed in natural language, and what should be included and should be explicitly excluded to get the best signal out of it. So we rely on that for our purposes as well. There's a whole team of about, I think, 15 or 16 analysts these days at Public Health Agency who use GPHIN to do their triage tagging and reporting work every day, day in and day out. They're awesome. That's a useful signal in that the articles that the analysts care about also tend to have extremely high public health value, and so you'll often see them actually go through and highlight particular sentences in various articles and add notes along the way. We also have a geographic gazetteer, and we ingest data from ReliefWeb. So this is what GPHIN looks like. I've pre-populated a little search here. This is looking for news that has recently, in the last 14 days, talked about RSV. So I'm looking at the US context here, because RSV tends to be on the downslope in Canada right now. And you can see just from this very first search, I had a hypothesis in mind that RSV might have pockets in America, and we can see that the Northeast and around the Great Lakes looks like there's a lot of talk in the news about RSV and not so much on the West Coast. I'm curious about whether RSV is really bad there, so I might take a next step and add an extra criterion and say, tell me about articles that are also talking about deaths. And the map changes a little bit. We see that it really lightens up on the West Coast of the US and still stays pretty strong about the Great Lakes. So at this point, I might want to change my graph. We were just looking at time series data before. Now I'm curious to see what keywords are getting mentioned in these articles. There's nothing too scary here. It mentions RSV, of course, COVID, influenza, tests. So you can imagine the news these days talking about the tridemic. So often when there's mentions of RSV, we're also going to see some mentions of COVID and flu as well. Nothing too surprising there. At this point, I would typically, if I'm using GPHIN for work, I might want to start digging down into the actual news articles that came in. A lot of these are just kind of COVID heavy right now, but I noticed this one here. Elko Hospital says RSV cases are rising. Well, in North America, we think RSV is on the way down for the season right now, so this is a bit surprising. So I can take a look over on the right-hand column. I see that it's got a relevance score of 0.9. That's pretty high in general. And I kind of click down to pull up this automatically generated summary. So we have a full news article, but one of the pieces that we've built in is this extractive news summarization tool. So that you don't even have to click all the way through to the news article. You can quickly see that this particular news article talks about some hospitalizations, but most of them are with flu and COVID. So from an RSV perspective, maybe this isn't worth digging into further. If I'm a Canadian epidemiologist, I might have just clicked on this because I didn't know where Elko was. And I can see that it's talking about counties, so it's obviously outside Canadian borders. So I may click through a little bit further and I see that, oh, holy cow, there are 533 new cases of RSV confirmed in New Brunswick, more than last year's total. And again, I might open up the summary and see that, oh no, this article is very much about RSV. So I'm now suddenly highly interested in this. I can click through to the article itself. I don't expect you to read this all. This is a little small on the screen. Down the left, we can again check the relevance scores, see when it came in, see where it came from. There's a tagging feature where the GPHIN analyst team has already tagged this for a daily report. So that already tells us that it's highly relevant. There's a categorization here. We've machine categorized this article as being about human infectious disease. So if you're interested in enteric disease, you can now click away. This article won't interest you at all. And there's keywords down below. Over on the right up top, it says duplicate articles, and we can see that this article has come in a second time from presumably a different news source, probably another provincial version of the same publisher. We have the original context from the news article, so if there was something, if we had to make a decision, we now have the full context. And down below, there's a chance to add some notes in. Looking at another example, this is about monkeypox. Monkeypox has been, of course, moving around, and we had the same hypothesis. Where is monkeypox today? It seems to have really died down in North America. Is it still a concern? So we do a search here for looking for monkeypox keywords, looking for the keywords related to cases. So we're not interested about vaccination development or rollout. We're interested in cases here. And we're looking for a tag about monkeypox human cases. And similar to the map Stephen showed earlier, we see this big pocket in northern Argentina. So this is an example where the news is correlating reasonably well with the more reliable, but maybe slightly later, official public health information. And now we get into the fun stuff. So everything I've just shown you presupposes that we have a hypothesis in mind of something we want to look for. But from an early warning perspective, we might not need that. We might not have that hypothesis ahead of time. We need to generate those hypotheses. So we have what we call narratives. This is an early warning signal discovery tool. We're looking for unknown unknowns. One thing we're very lucky with this distributional semantics assumption and with the keyword ontology Public Health Agency has developed is we know the language around mysterious illness and how that gets expressed in news data. We also know we have a full set, not full, but a very large set of syndrome names and symptom names. So often reporting for something early and scary, they mention symptoms and they mention what syndromes it's not. So in the early news reporting of COVID, it was, pneumonia and fever, not SARS, not influenza. And we didn't know what it was, but we didn't know what it but we did know what it wasn't, according to the news reporting. So that's enough signal to do something interesting with. So our technique looks at the keywords that have been applied for a news article and looks at what locations are mentioned in a news article and does a machine learning unsupervised clustering task on that. It's looking for overlaps of what keywords were mentioned a fair bit in the context of certain locations. And over the last 24 hours, are there any of those that seem unusual? So once a day, we go through for the last day's worth of data and say what keywords were unusually common in locations compared to recent history. From there, we generate rules. So if we discover an unusual number of mentions of a particular keyword like mysterious illness in a particular location, say Réunion, we would generate a rule and say if anything else comes in from now for a while about mysterious illness in the Réunion, we want to append it onto this narrative so we can start tracking that immediately in the system before we even sent it to a human. So we collect those articles over time, and then we do topic modeling from there. What we're looking for, especially a couple days into this early warning, is we want to see, is the language of the reporting changing in ways that we can notice? So you can certainly imagine early on for something like COVID, there was a lot of talk about South China seafood market, there was a lot of talk about Wuhan, and there was a lot of talk about uncertainty. And then weeks later, after it had started to spread, particularly as it was spreading internationally, the news coverage then very much started talking less about the seafood market and more about aviation, border closures, where it was popping up. And so the language of that news changed in a way a machine can spot without human intervention by using topic modeling, seeing what topics pop out, and then noticing when that set of topics changes. So we call that a change point, and that's something we infer as well. And then we put it all together into a user interface so that someone can go in and see, of yesterday's 10,000 news items, what are the 20-ish topics that might have popped out today, and what's going on with them. So that's the early warning system that we've got built into GPHIN today. If we're talking about moving forward into how can we build even better early warning systems in the future, there's a couple of lessons learned that we can share that have helped us increase the ratio of signal to noise. So one is categorization. Different people in the public health system have different interests. So when we have news data or any data like this, if we can put it into the category that corresponds to the people who care about it, that's very important from a signal to noise ratio. And Stephen mentioned that in terms of ProMed as well earlier today. So when we have an all hazards and multidisciplinary system, it's important to have categorization so that the people who care can put the blinders on and get down to the data that they care about. I think it's really important to work with multilingual data. There is sometimes a temptation in the West to really treat English as the lingua franca, and it's not. A lot of the interesting reporting comes out in local languages. And we live in the modern age of really good machine translation. So even if we don't have a technique and expertise in a particular local language, we can often get enough signal out just from the machine translation. And in the GPHIN case, the analysts over at Public Health Agency speak all 10 languages themselves. So they have a Farsi analyst, they have an Arabic analyst, they have a Chinese analyst. Being able to do the work in those native languages is of high value as well. And as a fallback, using machine translation can usually get enough signal out. We're also using cloud machine translation, which is great. Our machine translation models get better year by year, and we don't have to lift a finger. That's fantastic from our perspective. Case counting is something we're very interested in. This is an entity tagging task, essentially. News is very good, surprisingly, at reporting number of cases. So it'll say, 533 cases of COVID or of RSV have been reported in New Brunswick. We can find that signal in the news very easily and track that as a number over time for a given geographic location. This is also really good for deciding when a document is a duplicate of a previous document or not. So often in news media, there's often a template in a pandemic scenario that a journalist will be using, and several times a day they'll just go in and update the number of deaths or the number of cases or the number of recoveries. And that's important signal to watch. So even though a news article might be word for word identical, but for a number, that's important to know so that we don't treat those articles as the same thing. So I think case counting is quite important. Location resolution is something we've gotten very good at with a lot of time. This is actually a surprisingly hard task. So for those of you in Ontario who might know Ontario geography a bit, Just down the road here, we have London, Ontario. There's London, UK. There's a Paris, Ontario nearby. There's a Paris, France. And this is actually fairly easy for a human to see in data and relatively difficult for a machine to figure out in data. So we think we're at state of the art at this. It's a very tough task. Probably the worst one is Santiago. There are like 300 Santiago de Cuba, Santiago de Chile. Santiagos happen all over the place. And it's important from a public health perspective to know which Santiago counts at a given time. We've also integrated this with Relief Web. So if there's a new public health crisis in Yemen, for example, we can click on Yemen, get the most recent data from yesterday from Relief Web, and see the context of what other humanitarian crises might intersect with whatever's going on in the news today. Noise reduction is important too, with any kind of signal like news data. If Taylor Swift or Justin Bieber faints on stage, that is all the health news the next day. That's not interesting from a public health perspective. Bieber fever is not really a symptom. So we want to be able to get rid of that data. So the two major pieces we have for that are relevance scoring. Every document that comes in, we compare to a known set of highly relevant documents and a known set of highly irrelevant documents that we've seen over the past, that we built up over time. And we try to assess, kind of on a sliding scale, where it is between those two extremes. And the second piece is near duplicate detection. Anytime a duplicate comes in that mostly has the same sentences in mostly the same order, we want to put those two together and say this is really one thing, unless it's talking about case counts. And finally, reporting and alerting. In terms of early warning systems, at some point you need to get the data back out. So in GPHIN, we have some reporting and alerting tools that the analysts at Public Health Agency use. We've collectively made the choice that having human in the loop for reporting and alerting is very important. Because knowing what to do from an ethics point of view, having a human do that, I think, is fairly important. So building tools to increase the productivity of those people who are making those decisions and getting them the information they need with as little noise as possible is fairly important. But at a certain point, you need a human in the loop to press the button and say, here's what we need to do next. I think every talk about machine learning needs to have a slide that says the word ethics at the top. This is a discussion we have internally all the time, every day. Some days it's even fun. We think the tools that we've built in GPHIN are ethical. We're using open data, so anything that the system is doing, a layperson could do if they had the right information in front of them. We're aggregating the data over a large set. We have a human in the loop for all decision making, and we're trying to produce public benefit. I'll leave it there. That is a long discussion, and if any of you would like to have that after the fact, I would love to get into that. Furthermore, as a platform, GPHIN supports other research. So on the Public Health Agency side, they've been doing a lot of collaborations with Université de Montréal and University of Toronto and others as well, because we now have this huge multi-year, very broad, I think we're up to about 20 million news articles in the current system these days. So we've got this nice long textual time series data. And over on the NRC side of the fence, we do collaborations with other agencies as well, using similar data. So 3 things I'd like you to take away today. News has useful signal for early warnings for public health. To get that signal out, there is great state-of-the-art natural language processing available in this day and age to turn that text into things we can count and map and collate together as events. And GPHIN is one such example of using natural language processing to generate early hypotheses for early warning systems. And I'm sure as technology keeps changing, we could do even better in the future. I'll leave it there.
Thank you, Dave. Any questions? And again, online attendants can just put the questions in the chat window.
Thank you. Thank you for your talk. It was great. Can you hear me? Excellent. So I'm wondering if the tool that you just introduced is publicly available for anyone to navigate.
Half and half. It is open to public health professionals. It is a free tool. We do have a bit of a limitation with Dow Jones in the number of people who can access it. So not just anyone can go in, but if you go to the GPHIN page, there's information there for signing up.
Great, thank you.
Thank you for the nice talk. Actually, I have two questions. How do you calculate the relevance? And the second one, since I think you are detecting 10 languages, right?
Detecting what sort of languages?
10 languages.
Yes, correct, yeah.
In time, if you have the same abbreviation for two things, like MPX can mean monkeypox and also can mean, I believe, enterobacterial peptide. How can you detect this difference between?
I'll start with the second first. That's a task that in the natural language processing community we'd call word sense disambiguation. You can think of an even simpler version of that, the verb lead versus the metal lead. Lead poisoning is important, leading is not. So there is an entire field of natural language processing about seeing a word or abbreviation in context, and by looking at the words around it, we can try to differentiate which of those two meanings it is. For the relevance scoring, we use a support vector machine, and it's trained with two classes, one of highly relevant documents and one of highly irrelevant documents. This leads itself really well to explainability and to updates over time. So on the rare occasion we get a score egregiously wrong, we have a feature built into the tool where an analyst can mark it and say, you know, this was highly relevant and it came in with a relevance score of 0.15. They tag it and that becomes training data for our next iteration of training. So it's basically looking at n-gram features, so sets of 2, 3, 4, all the way up to 7 words. We throw those in as features to a support vector machine. Our two classes are highly relevant, highly irrelevant. Then when we need to assess relevance score, we take a new document, we throw it in, and the SVM essentially gives us back a class probability for both those. Yeah.
Thank you for the lecture. Yeah, so one of the questions I have, I want to ask, how do you filter out the fake news? As in COVID, we know we had a lot of fake news during COVID, so how do you filter it out? The second one is in public health, we're always looking out for reproducibility in data. So do you have data that, yeah, if you want to analyze or other agencies want to analyze, they can be able to get close to the result that you got? Thank you.
Both great questions. Fake news is obviously a huge problem. Part of that goes down to sources. So fake news tends to stick together. So we're fairly selective about what publishers' data is allowed into the system. But even that's tough. So you can imagine let's use Fox News as an example, not to pick on them, but a lot of Fox News local reporting for public health is just fine. So, you know, Fox Boston, their reporting on what's going on with COVID is just fine. The Fox evening newsertainment programming, not so much. So we don't have it solved entirely. Part of it is from the relevance scoring. So we, to some extent, we know the language around what fake news might look like, but that's not infallible. We're very lucky in GPHIN specifically that we have this team of dedicated analysts who's going through it, who can spot that and say, even if something slips through in their daily triaging and reporting activities, they're going to spot and say, this doesn't make sense. So they can either flag it for follow-up or just trash it entirely, and then it's gone from further consideration. For reproducibility, that's a very broad question. It's a good question. Part of it is that we have data going back to 2015 now, which covers several different scenarios of interest. You know, we now have pandemic data, which is very exciting, but even smaller things like radiological releases, food contamination issues. And it's fairly common on the public health agency side of the fence for a minister to come down to public health agency and say, outside of the system, I have heard about this. Tell me what's going on with this situation. And so the public health agency needs to be able to have that data nearby and be able to respond very quickly to that minister's request. So they tend to have the data at hand. That's not quite reproducibility, but they have the ability to go back after time and see what happened at a given, in a given place at a given time. In terms of our machine learning techniques, which are much more focused, then we have the ability to evaluate with held out test sets and do the normal thing where we have a development set, a test set, a training set, and be able to evaluate them fairly against each other and publish results.
Any other question? No, we have one question from the audience on Zoom. Why did GPHIN get shut down in May 2019?
I have no information about that. I am not an employee of Public Health Agency. There were 2 written reports, if you would like a more detailed answer to that. There was an Arm's Length Health Canada review, and I believe the Auditor General of Canada went in as well. So there's lots of information in those 2 reports. I'm going to cop out and say I'm just a poor, lowly engineer at the National Research Council with no opinions at all.
Thank you so much. We can thank the speaker again. We are coming back in the afternoon at 1:30.